Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, most people go to their healthcare provider when they're feeling sick, but not all visits to the clinic are just because you're not feeling well or because you're injured. Preventive medicine is an important part of a healthcare provider's role over a patient's lifetime. And here to tell us more about it today is Adriana Jensen. She is a certified family nurse practitioner at Mayo Clinic Health System. And Adriana is the primary provider at the clinic in Sway City, Iowa. Thanks for joining us today on Speaking of Health.
Thanks for having me.
Well, today we are talking about preventive medicine. First of all, what exactly does preventive medicine mean?
Well, preventative medicines are the measures that, as providers, we take to prevent disease instead of curing them or treating the symptoms.
So if people follow preventive medicine guidelines, what does that mean?
Well, most people who follow these guidelines lead a healthier life and stay healthier.
And where do the guidelines, preventive medicine guidelines and recommendations, where do these come from?
Well, they come from various organizations, including the American Cancer Society, the American Medical Association, the American Heart Association, as well as our U.S. government has a few, like the Department of Health and Human Services, as well as the U.S. Preventive Services Task Force.
Well, let's start out by talking about some of the most common guidelines, and something that probably a lot of patients think about when they think about preventive medicine is getting your shots.
Right, and it's not only important for children or infants to get their immunizations, it's also something for adults to think about. So the number one immunization to think about is like tetanus and diphtheria. We recommend that adults get boosters every 10 years, or unless medically indicated, like if you were to step on a rusty nail or come in contact with rusty metals. Another one is influenza vaccination, which we recommend annually during the peak flu seasons, which is between September and March. Those are recommended for all ages, but mostly for those who are over the age of 65, as well as those adults with chronic diseases and healthcare workers who come in contact with those who have the influenza virus. And another one to consider as an adult would be the pneumococcal vaccination, which helps prevent strep pneumonia. Those are primarily recommended for those who are of age 65 and older, as well as adults with chronic diseases and those who use tobacco.
And the pneumococcal vaccination, is that something that you have to take every year, or is it just a one-time deal? Or
if you get it after the age of 65, then it's a one-time vaccination. Although if you have the vaccination prior to that age, then you would need a booster at 65.
Okay. So Adriana, are there any other immunizations that you can think of when it comes to preventive medicine?
Yeah, one in particular for patients who are over the age of 65 is the Zostavax, or it's for herpes zoster, which is shingles, which can be very painful for patients to undergo. So we do recommend patients over the age of 65, whether you've had shingles or not, to get immunized for shingles.
And will that prevent them from occurring?
Patients who take the Zostavax, it typically does prevent future outbreaks of shingles, although there's a small percentage of patients who do end up getting another outbreak. And typically what happens is when they've had that vaccination, they have a less severe outbreak of it. You
know, Adriana, we talked about immunizations and screenings, but in particular the immunizations, a lot of people might think, well, I got my shots, I got my flu shot, so I'm not going to get the flu, or I got my pneumococcal vaccine, so I'm not going to get pneumonia. And that may be the case, but that's not always the case. It doesn't completely prevent everything, right?
Right. It's not a 100% foolproof immunization. There is, again, a small percentage of people who do end up getting whatever vaccination, like influenza or something like that. But typically, like I said before, this is a less severe case of it than if they wouldn't have gotten the flu shot. And majority of the population, it does prevent it, and you don't end up getting the flu or strep pneumonia or something like that.
So it's important to get those shots.
Yes, definitely.
You know, Adriana, we talk about all these different preventive medicine recommendations and guidelines, and there are time frames for those. your tetanus shot every 10 years. And a lot of people, it's hard to remember something like that. And that should be information that your provider can help you with, right?
Right, that's what we're here for, is we're here to assist you in your health. We're here, and we have records of that. So, contact your provider, and they should have records of when your last tetanus was, or when was the last time you were screened for cholesterol and things like that. So check with them.
Well, another thing that should probably be checked off the preventive healthcare checklist is all of the various cancer screenings, right?
Yeah, there are various cancer screenings for female and male patients. For the female patients, it's good to consider breast cancer screenings, which includes a mammogram. For patients over the age of 40, you'd want to get those every 1 to 2 years, and then annually after the age of 50. Clinical breast exams are also recommended just at your annual physical, as well as discussing with your healthcare provider whether you have a history of breast cancer in your family. Cervical cancer screening is another one that's important for females. This is done through a pap smear, and we usually recommend this for patients starting at age 21 or sooner if they become sexually active. Pap smears are given annually as long as you have 3 consecutive normal pap smears, and then you can extend that out to every 3 years, unless otherwise directed by the healthcare provider.
Those are all female cancer screenings. How about for male patients? Are there cancer screenings specifically for male patients?
Yes, of course. The primary one for males is prostate cancer screening, and you'll want to start discussing this about age 40. And it's a simple blood test called a PSA, and this just measures and screens you for possible prostate cancer.
And that should be discussed with your provider ahead of time? Starting at age 40, you said?
Starting at age 40 at your annual visit, you can discuss that with your provider, and they can give you options that include the PSA test.
Okay.
Yeah.
Well, are there any other cancer screenings?
Yes. For male and female patients over the age of 50, we want to consider a colonoscopy for colon cancer screening. You'd want to get this every 5 to 10 years. You'd also want to start discussing this earlier if you have a family history of colon cancer. And there's also an annual stool test that can be ordered by your provider at your annual visit.
And that standard of every 10 years starting at the age of 50, is that for male and female both?
For male and female, yes, correct.
Okay. Well, besides getting your shots and the various cancer screenings, are there some other recommendations when it comes to preventive medicine?
Yeah, blood pressure screening is really important. For most adults, we'd like to see you about every 2 years, and the goal would be 130/80 or less. Obviously, you'd want to be screened more often if you have high blood pressure or a family history of high blood pressure. Another one that we'd want you to be screened for is cholesterol, especially if you have a risk for heart disease in your family or you yourself. This test is recommended every 5 years for those age 18 to 75, or more often if you actually do have high cholesterol. The goal is a total cholesterol less than 200 and LDL cholesterol less than 130. Now, these numbers might be lower if you have a risk factor or if you have another chronic disease. So you'd want to look to your provider to see what would be best for you.
And the cholesterol screening, what kind of a test is that?
That's a blood test. It's a fasting test, so you'd not want to eat or drink for 8 to 12 hours prior. Most of the time we recommend our patients to come in the morning and receive the test before they see their provider. That way their provider can see their results, as well as then you're not waiting all day being hungry.
Right.
You can just get up in the morning and get the test done. Yep.
How about any other screenings?
There's an osteoporosis screening, which we mostly think of women, postmenopausal women primarily, but also men over the age of 70. And this is done through a bone density measurement. It's called a DEXA scan, and it scans your bones to measure how strong your bones are. So that is recommended for postmenopausal women and men over the age of 70.
So the osteoporosis screening, the DEXA scan, is that a one-time screening, or do you have to do that every so often?
Well, you would want to start with a one-time screening, and then depending on the results, you'd want to talk with your provider. Usually about every 2 years for this age group is what we recommend, but it kind of depends on your results. So be directed by your provider.
Well, we talked about shots and screenings, but is there something else that maybe stands out prominently, you as a provider, that you see that when you think of preventive medicine and preventing people from getting sick and causing disease?
Well, something that we see quite often as healthcare providers is the effects of smoke and using tobacco. People who use these type of products really put themselves at risk for about every chronic disease there is out there. So we do screen our patients every time they come in to see us, and we strongly urge them to quit using these products.
And when you say you screen your patients, you ask them if they...
Right.
It's not a test that they take.
Right. No. Yeah. We ask them if they use tobacco or if they've ever used tobacco. We also ask them how much per day and things like that. So, and then we strongly urge them to quit, and we give them resources to do so.
So any other words of advice for preventive medicine?
Yeah, we always encourage our patients to be active. So physical activity like walking daily, 20 to 30 minutes is good for overall health, as well as adopting a healthy diet with plenty of fruits and vegetables. And remember, a colorful plate is a healthier one.
So it's not just about going to your doctor and getting tests done. It's also about managing your lifestyle, right?
Right. It's about being proactive in your own health and taking action as far as staying active and adopting a healthier diet for you and your family, but also using your provider as a sounding board or someone that can assist you in being healthier.
How about physical exams? Getting your physical. Like, how often should someone come in and just get a plain old physical?
Well, I think it depends on your age. Those in their 20s, you know, every 2 years is probably adequate if they're generally healthy. But, you know, once you start getting older in your 30s and 40s, an annual exam is definitely recommended. And in your 20s, an annual exam sure doesn't hurt. At 30, you know, annually, just checking in with your doctor to see if anything's changed or if you need to do anything else is important.
Just having that conversation with your provider and keeping contact with them and that connection, that probably helps a lot.
Yeah, over the lifespan, just having that data over a lifespan of everything that has gone on in your health is important. Even if you are generally healthy, it's good to keep that relationship going.
Well, let's talk a little bit about the clinic at Sway City, which is where you're the primary provider for. Is relatively new now for Mayo Clinic Health System in Sway City, right?
Yes, we opened September 2010, and we're in the Main Street Manor, which is an assisted living facility in Sway City, Iowa, which opened just a month or two after they were accepting residents at that time. So it's a new building as well. And we've been serving patients Mondays 8 to 4:30, and Wednesdays 8 to 1 I'm there, but my nurse stays there till 4:30 just to provide a lab, so anybody who needs their blood drawn or anything like that, they can go to her and she can get it to the appropriate provider from there.
And we talked about preventive medicine and blood pressure screenings. You actually give free blood pressure screenings in Sway City, right?
We do on Wednesdays from 12 to 1. We provide that service to our patients, and we've had a good turnout so far, so we're hoping people continue to come in, and we'd be happy to help them out with that.
Great. And the free blood pressure screenings are also at Mayo Clinic Health System in Fairmont as well on Thursday from noon to 1, and are also at the clinic at Walmart as well. You can come in and get your blood pressure checked for free as well. So the clinic at Sway City, overall, the reception has been very well and has been growing?
Yes, yeah. The people there are wonderful. They're so excited to have a clinic there because they haven't had one there for, I believe, 5 years or more. So they're excited to have a resource, and they've just been very, very welcoming.
And you're a hometown girl. You're from Sway City, right?
I am from Sway City, and you know, it's great to be home, helping serve the community that helped raise me, and it's just wonderful to be around that small town community.
And the primary services that you provide in Sway City are?
Well, we're family medicine, so we provide anything that you would see your family doctor for. So we see patients from birth all the way up to our senior citizens. We do have a lab, so we can either send the lab work up to Fairmont, or we do have a limited amount that we can do right there in Sway City, which is really nice for our patients.
Well, unfortunately, we are all out of time. I'd like to thank Adriana Jensen, Certified Family Nurse Practitioner for Mayo Clinic Health System, for joining us today on Speaking of Health, a great topic.
Thank you very much.
Have a great day, everyone, and be healthy.